Good morning and happy Friday, everyone. Thank you so much for joining our second AOF budget webinar series for the 135th General Assembly. My name is Kelsey Bergfeld. I'm the Director of Advocates for Ohio's Future. We are a coalition of health and human service organizations, policy folks, researchers, providers, really united to make sure that families have the best start and have what they need to live really healthy, successful lives in quality communities all across Ohio. I am very excited today to be joined by two of my friends and colleagues, Joree Novotny from the Ohio Association of Foodbanks and Loren Anthes, a visiting fellow from the Center for Community Solutions, to tell you about and really give you an update on the end of the federal public health emergency and what that means for different federal programs, enhanced benefits and flexibilities that have really been in place since March of 2020, which feels like so long ago, folks. It's been 3 years since a lot of these flexibilities have been in place, that folks have had that extra boost in support from these public programs that we know have been so vital throughout the pandemic as we continue to recover, especially. We know the federal public health emergency is coming to an end, but we will also see some changes in some really significant programs before that happens. So I will go ahead and kick us off and give you a couple updates and tell you where we've been with the public health emergency. And again, very excited to be here. I'm the director of AOF, and I'm also want to give a shout out to Sarah Hudasek, our policy associate here at AOF, and really keeps the wheels running and is fantastic and has really helps bring these webinars to you, as well as incredible research and website and communication content. So thank you so much, Sarah. All right, we can hop on to that next slide. Wonderful. And I actually looked back in my notes, and we were here with you back in April of 2022, talking about the COVID cliff for the public health emergency unwind. And now we have some answers. You know, when we were back with you in April, it was a waiting game. A lot of these flexibilities and these programs that we will be speaking about were renewed every 90 days with the federal public health emergency. That came to an end with the passage of the Consolidated Appropriations Act by Congress at the end of last calendar year. So what the Consolidated Appropriations Act, or the CAA, did was delink a lot of these, again, enhanced benefits, flexibilities, and programs from the federal public health emergency. There was some conversations in Congress saying that, you know, the economy is recovering, that the public health situation is improving, that there was some pressure to get back to normal in these programs and reprioritize some spending. So we did see that delinkage from the federal public health emergency to a number of these programs. Now, some programs are still linked to it, and we'll talk about those in just a second. But really the two major programs that we'll be talking about in the SNAP, or food stamp and food assistance nutrition support program, and Medicaid. So just a quick reminder, the federal public health emergency has been in place since January of 2020 and has been renewed every 90 days as we move through these past 3 years of the pandemic. We did receive notification from the Biden administration that it will end on May 11th of 2023. So we do have an end date, although some of those changes that we'll see in those major programs will happen before then. There are still a few things that we're keeping our eye on that are tied to it. Next page, please. And really the reason why we wanted to pull you together today to give you this update and why it fits into our budget series is that these changes that we're about to see in these vital support programs and SNAP and Medicaid are really framing our approach in advocacy to the state budget, making sure that our elected leaders are paying attention to these changes that are about to happen and the impact that they're going to have on families and the needs that are going to arise as a result. So that really has framed Advocates for Ohio's Future, AOF's approach to advocacy in this budget. And that is a major part of all of our legislative conversations that we're having with leaders, making sure that they're aware of these changes and what can be done once we start to see those impacts. So how we're framing this and really what we're talking about, all these changes, what we're calling them, is the COVID cliff. Because we know that once the end of these changes happen, they're all going to happen at about the same time and really impact the same population of folks. So we could see the same family see a reduction in food support of a couple $100s per month. We could see that same family lose health insurance, and we can see that same family, have some student loans but get turned back on later this year. Really, access to things like emergency rental or mortgage assistance is very limited, if available, in many communities. And we'll also see the roll-off of some public programs to help with public utilities and such. Really is not as widespread as we had seen during the peak of the pandemic. So thinking about the same family, having all those different changes, impacts to their checkbook, to their budget, is going to be a struggle for many, as we're still considering recovering from the pandemic, as well as knowing that we're not generally in the same economic position that we were pre-pandemic. Inflation is certainly a factor for rising costs for basic needs, housing, food, utilities. My heating bill, I think, has almost doubled and will continue to go up as well. So we know that this cliff, is something that we can see. We see it on the horizon, and we want to make sure that we prepare families who rely on these programs, who need these additional supports, as well as inform our lawmakers on how they can support those families moving forward. Excellent. So again, our guests today, Joree and Loren, are going to dive into really the meat of the changes in the SNAP and Medicaid program, but I wanted to bring a couple to your attention as well, just to keep in mind as we talk about some of those other larger changes. We know that federal student aid has been a big discussion in Congress. We know that student loan payments have been on pause since March of 2020, and that has helped a lot of folks and families stay afloat during this time, making sure that those dollars can be redirected towards basic needs. They have been on pause for about 3 years. There has been discussion at the federal level around student debt relief, different awards for lower income and different kind of payment plans have been in discussion in Congress. There is some litigation happening around the passage of some of those proposals. So as of now, the student loan payment pause is extended until this litigation has been resolved. Assuming, or if that does not happen, that by June 30th of this year, payments will resume 60 days after that. So 60 days after June 30th, so that's July, and at the end of August. So the average Ohioan who does have student loan debt, the average amount is around $400 per month. So that is, again, a significant cost coming back into family budgets, and something that could impact a family, again, who's still trying to make up for those losses in SNAP and possibly in health coverage. We also know that emergency rental and mortgage assistance is limited if available in some communities. Some communities, it's very easy to access through your community action agency. There's still some left. We know that there are some limitations on what those dollars can be used for to support, but is certainly becoming less available starting this calendar year. And then we will see with the end of that federal public health emergency, I just wanted to highlight a couple of those changes that are still tied to the end. So coming in March, we will start to see start of cost sharing for COVID-19 tests as well as treatments. For folks, we will also see the end of some of those flexibilities for telehealth platforms that were in place throughout the pandemic. We know that those were very, very vital in continuing folks receive vital health care and behavioral health care during the pandemic, as well as we'll see some of those other flexibilities in terms of staffing and different clinic sites and sites for care within the health space. So those are continued to be tied to the end of the PHE, and those will end on May 11th, coming up in this year. So really, to tell you what we've been doing, we've been preparing for this cliff and thinking about how best to prepare folks and clients and consumers who use these supports, as well as making sure we keep our stakeholders, community partners, healthcare providers, and our elected officials informed on what's happening. We formed the Ohio COVID Recovery Coalition here within Advocates for Ohio's Future. We had a lot of other partners outside of our coalition join us to really focus on the major changes happening in health, nutrition, and family support. So I'm excited to, again, be joined by two of our leaders here from those conversations, tell you more about what we've come up with, how we worked with decision makers on how to make this process really as easy, as smooth as possible. We know it's going to be harmful. We know folks are really going to be negatively impacted by these changes. However, we wanted to make sure we could do our part to mitigate those changes and those impacts as best as we could. And just to give you a brief idea of what we have at AOF been advocating for, really before the end of the last General Assembly, we wanted to make sure as these changes happened in the SNAP and Medicaid program that we boosted our community services to make sure that they were prepared. We know that when folks lose supports and lose those benefits and participation in those programs, they look to local service providers and assistance first. So we have been looking for some investments in those local services to really boost their capacity to be able to take on this COVID cliff. We were successful in some areas, not successful in others, but we hope that those investments that were successful will make a difference in making sure that folks can support their basic needs throughout this transition. And with no further ado, I'm very excited to introduce Joree Novotny with the Ohio Association of Foodbanks to tell you more about what those changes were in the Consolidated Appropriations Act on SNAP and nutrition policy. So Joree, whenever you're ready, please take it away.
Thank you, Kelsey. It's great to be with everyone this morning. Thanks for joining us. My name is Joree Novotny, and I'm honored to serve as Chief of Staff for the Ohio Association of Foodbanks and to have been a part of Advocates for Ohio's Future efforts throughout the public health emergency to make sure that we're hitting all of the marks that Kelsey highlighted. So I'm going to go ahead and you can go to the next slide, and I'm going to talk with you about the end of SNAP emergency allotments. SNAP emergency allotments were passed by Congress and the Trump administration all the way back in spring 2020 to respond to the impacts of the pandemic on households with low incomes or experiencing loss of income. They were tied at the time to the federal public health emergency as well as state level emergency declarations. And you all know all of this was done when none of us knew much about how drawn out the impact of COVID-19 would be on communities, on households, and on our economies and supply chains. So I'm going to talk about how these temporary benefits played a significant role in bolstering households hardest hit by the pandemic's economic impacts and the past 14 or so months of drastically high inflation, of course. How the Consolidated Appropriations Act decoupled these benefits from the public health emergency, and the steps we can take to support Ohioans and mitigate the drastic cliff ahead. Households participating in SNAP all have to have very low incomes to qualify. So just as a reminder, in Ohio, to participate in SNAP, households' gross income must be at or below 130% of the federal poverty level. That's about $32,000 a year for a family of 3. Their net income after deductions like shelter expenses, utility expenses, childcare expenses, and out-of-pocket medical expenses must be below 100% of the federal poverty level. So how much lower their net income is compared to the federal poverty level determines how large their base or normal SNAP benefit is. Households with very little or no income may usually qualify for the maximum SNAP benefit amount, whereas households with more income may only qualify for a minimum SNAP benefit amount or a much lower one. So during the public health emergency, SNAP emergency allotments brought every SNAP household up to the maximum SNAP benefit amount for their household size. For a family of 3, that benefit is currently $740 per month, which is $2.75 per person per meal. For households that already qualified for the maximum SNAP benefit amount, they have been receiving an additional $95 per month. So just again, to put that in larger context, for each month throughout the pandemic, Ohio has received $120 million or more from the federal government to help feed its residents and support its food supply chain and local economies. Economists estimate every dollar in SNAP spent locally generates anywhere from $1.50 to $1.67 in economic activity. So even estimating conservatively, that means that the loss of these SNAP emergency allotments will mean the loss of $190 million each month in federally funded monthly economic activity in Ohio. That will specifically impact local grocers and retailers, their workforce, and the larger food supply chain, which we all know is already fraught with ongoing challenges. And of course, most importantly, these SNAP emergency allotments pushed back throughout the pandemic on significant threats to food and household security. A study estimated that emergency allotments kept 4.2 million Americans above the poverty line in the last quarter of 2021, reducing poverty by 10% and reducing child poverty by 14%. That estimated reduction in poverty rates was highest for Black and Latino people. So this intervention was extremely impactful for households with low and moderate incomes, and particularly those households that are normally or often left out of how we focus our economic response to crisis. So you can go ahead and go to the next slide. Every SNAP household will lose at least $95 per month beginning in March. You can see averages here on the left for one person and on the right for 3-person household sizes. But as you can see, households with slightly more net income will suffer the most drastic loss of purchasing power. So if you can see on these charts, an average 1-person household will lose $132 when SNAP emergency allotments end, but 15% of 1-person households will lose $258 a month. They will go down to the minimum SNAP benefit amount of $23 per month. If you look at an average 3-person household, will lose $197 per month when SNAP emergency allotments end. 18% of those households will lose an average of $441 in benefits. And what this does is actually create a larger cliff for working families with children, for older adults, and people with disabilities who have fixed incomes. It's going to harm those households most drastically, but it will harm all households across the board that count on SNAP. Households with children will lose $223 on average per month. Households with adults 60 and older, the average decrease will be $168. Households with disabled people will see an average loss of $190 per month. And I'll just restate again, lower income households will lose less because their regular SNAP benefit is higher. Households with higher but still low incomes, especially working families with children, will lose more. These estimates conceal wide variation even among households of the same size. So for example, the average decrease among 1-person households, like I said, will be $132 per month. But by contrast, again, 1/6 of those households will lose much more, over $250 per month. And those are really the households that we're, extremely concerned about. So you can go to the next slide, Sarah. So our coalition and other stakeholders and trusted messengers are, of course, working, as Kelsey said, to inform consumers about this change, to mitigate confusion, limit unnecessary calls to what we know are already very taxed benefits call centers and county phone lines. And I know that my fellow presenter, Loren, will talk more, I'm sure, about the workload management processes and tools that will need to be utilized heavily as the broader unwinding evolves. But as I'm sure most of you know, the same county caseworkers that handle the SNAP caseload also handle the Medicaid caseload. Call center wait times and eligibility determination timeliness are already major and widespread concerns, not just in the largest metro counties, but in many others. And these concerns are only going to grow as consumers begin to be redetermined for Medicaid eligibility and experience these other changes to their circumstances. And additionally, many counties are understaffed and struggling to hire, retain, and train, especially now entering an environment that will be more punitive than many caseworkers have previously operated in. Those staffing challenges are likely to worsen before they improve without investment. So we're grateful that the Ohio Department of Job and Family Services opted to accept a federal waiver offered by USDA and make it available for counties to opt into. And as we understand it, 17 counties or clusters opted into this waiver. This is not a waiver on the initial application interview, which is really critical to help inform SNAP applicants about the deductions they can take and how to use their SNAP benefits. But this will allow the counties that have opted in to waive the 6-month recertification interview and instead recertify through a more passive mail directed form, which should require significantly less caseworker resources. And we hope that that does have a positive impact for those counties that have opted into the waiver. Next slide. In addition to so-called able-bodied adults without dependents that are subject to a work requirement to receive nutrition benefits through SNAP, a work requirement which has been introduced in most Ohio counties now, has been reintroduced in most Ohio counties, college students normally are subject to some of the most punitive SNAP restrictions. During the pandemic, full-time college students that meet normal income eligibility requirements and that are income eligible for federal work study or that have a $0 expected family contribution have been eligible for SNAP for the first time. Their eligibility is tied exclusively to the federal public health emergency, so it won't go away as soon as the SNAP emergency allotments. This expanded eligibility was not ended as part of the Consolidated Appropriations Act. But now that we have an end date on the federal public health emergency of May 11th, we know that these temporary rules will end 30 days after that, so in June. So any student that applies before that date will continue receiving benefits for their full certification period, that 12-month period. So let me give you a couple of scenarios. Let's say that I'm a college student who applies for SNAP in April. I begin receiving SNAP in April under the flexible rules that are in place now. I will continue to receive my SNAP benefits for 12 months. I don't have to call the county and say, hey, I heard that college students are no longer eligible, and actively report a change in circumstance. They will receive their benefits that they've been approved for throughout their 12 months. And truly, we just really hope that Congress makes these eligibility parameters permanent in the upcoming Farm Bill, especially as Ohio and the nation are focused on supporting workforce development. You know, we want to support workers transitioning into the new era of jobs that we need, and we need to support non-traditional students and students with low incomes as they go on that career journey. Next slide. Another component that was included related to SNAP in the Consolidated Appropriations Act was that Congress authorized USDA to replace SNAP benefits that have been stolen through criminal skimming enterprises. SNAP benefits are issued on electronic benefits transfer, or EBT cards. And these cards do not have a chip component, and they function basically like antiquated debit cards. They're very easy prey for criminal theft rings. Unfortunately, USDA previously did not have congressional authority to replace stolen benefits. We saw these stolen benefits pop up earlier, many months ago, starting on the East and West coasts, and they have made their way inland to many states across the country, including Ohio. The Consolidated Appropriations Act provided a temporary measure to grant that authority that USDA needed, with the expectation that a permanent fix would be included in the upcoming Farm Bill to make EBT card technology modernized and more secure. USDA provided guidance to states on January 31st about how they should implement a process for replacing stolen benefits. State plans are due by February 27th. In the meantime, ODJFS encourages SNAP participants to change the PINs on their cards regularly, especially before their benefit issuance date and after they make purchases. Participants should check when making payment for skimming devices that could be placed on like the point of sale device that they're swiping their card through. And they should also cover the keypad with their hand when entering their PINs to make payment so that scammers can't watch their PINs as they're entering them. If anyone that you work with or you yourself believe your benefits were stolen, change the EBT or cash PIN number right away, and then request a new EBT or cash card by calling for SNAP by calling 1-866-386-3071, the number on the back of your EBT card. And then also ODJFS instructs folks to notify their local county Department of Job and Family Services, who may advise them to file a theft report with their local law enforcement agency. But when we know more about the approved plan and procedure, we'll be sure to share it widely with everyone. Next slide. And briefly, the Consolidated Appropriations Act also contained good news of a permanent summer EBT benefit for children underserved by traditional summer food service programs. This represented the first new permanent federal food assistance program of this magnitude in nearly 50 years. It will be $40 per child per month during the summer break, which will be adjusted for inflation over time. This is starting not in summer 2023, when we will still have a pandemic EBT summer benefit, but in summer 2024 for low-income school-age children. And as you know, the traditional summer food service program reaches in Ohio just about 1 in 10 eligible kids. So this grocery benefit will help ease some of the burden that families face during the summer hunger crisis. Next slide. So finally, I'll just close by saying there's many ways that you can take action as a stakeholder or messenger. AOF and the Nutrition Subcommittee has developed several resources and education materials, template scripts, FAQs, flyers, social media graphics, just to help empower consumers with the information they need about their benefits. Some SNAP participants may not be approved for the correct amount in their base SNAP benefit because when they applied, they did not provide information about all the household expenses they have that are eligible deductions, things like childcare and medical expenses, or because they weren't asked about that information by their caseworker, since everyone was operating in an environment where every SNAP participant was receiving a maximum benefit. SNAP participants don't have to take any action, but if they feel that their base benefit amount, which is the amount they receive in their first issuance earlier in the month, is not correct, they should contact their county JFS to provide more information about eligible deductions, or they can also contact a SNAP outreach specialist at one of our food banks for help. They can go to ohiofoodbanks.org and click Get Help. Additionally, Ohio's food banks serve families with incomes up to 200% of the federal poverty level. So half or more of those we serve earn slightly too much to qualify for SNAP, but are suffering from prolonged food and economic hardship, of course. Last quarter, from October to December, Ohio food banks provided groceries more than 3.1 million times, the most significant quarter on record. And that pressure is only going to get worse. So we're asking Ohio leaders to take up other options to support Ohioans experiencing food hardship. They can also support free meals for all kids, as well as a state-funded minimum benefit. We should invest in our county workforce, assisters and navigators. And on the last slide, I just note a couple of places where folks can go to get more information. But now I'll turn it over to Loren Anthes.
Thanks, Joree. Really appreciate that. It's always hard to follow you in nearly anything related to policy, but I'll do what I can and really appreciate that update. For me, I'm going to try to talk a little bit about the Consolidated Appropriation Act impacts for Ohio Medicaid. To do that, I want to review a few things. First, the public health emergency, the act and provisions within the act, Ohio Medicaid and the impact of the act on Ohio Medicaid, and some tangential issues, as well as some considerations and resources. However, if you need any information or if you'd like to follow up with me directly about anything that I share here today, feel free to email me at lanthes@communitysolutions.com. I'd also just want to give a shout out to Kelsey Bergfeld and Tara Britton of Community Solutions, who recently appeared on the Prognosis Ohio podcast to talk about the state budget. I think there's a lot of tangential things here that are worthwhile, and I'll go ahead and put a link to that podcast in the chat. So first of all, the public health emergency, some things that you likely already know, but are important context for all of this. There are two aspects of the public health emergency that have impacted Ohio Medicaid, and not only Ohio Medicaid in terms of program development and benefit administration, but specifically the finances and then the enrollment aspects of the public health emergency. The first being around continuous enrollment, the requirement that any additional federal resources be tied into a maintenance of efforts so that people who are enrolled in the program are able to stay on the program as a condition of receiving that additional federal resources. So over the course of the pandemic so far, we're talking about 91.3 million Americans, which is an increase of about 20-some million Americans, or about 28.5%. In Ohio, this means that we now have roughly 3.3 million individuals on the program, which is an increase of about 1.2 million, or about 27.8%. Most of the folks who have enrolled through the public health emergency are those who are associated with Medicaid expansion, often also referred to as Group 8, kids or parents. In addition to the increased enrollment, we also saw additional federal resources come down in the form of enhanced federal match. So for every dollar in Medicaid, a certain percentage comes from the state and a certain percentage comes from the federal government to help manage the negative economic impacts of the public health emergency and some of those public health controls, the recessionary impacts therein. The federal government provided some additional resources, which also ensured that people had access to healthcare when they might be losing the coverage to their job, or that there might be additional utilization associated with hospitalizations, so on and so forth. And so for the United States, this represents over $100 billion as of October of last year. And in Ohio, this averaged about $100 million a month, which, according to the testimony from last week by the Medicaid director, is about $4.54 billion. And the group that is mostly benefited for this is through the age, blind, and disabled category. So you can see here that when it comes to the amount of money received from states versus the state spending, the disproportionate benefit went to states from a financial perspective and offset a significant amount of general funding. And I see here something for the recertification information in the email. That's good information from Joree for everyone there. So next slide, please. So a couple of things to highlight. In addition to some of the other programmatic or benefit related items tied to the waiver or tied to the public health emergency, there are a number of waivers and waiver authorities that the federal government enabled when it came to eligibility and when it came to redeterminations just generally. So Ohio has pursued a number of flexibilities, and we'll go over this here in a moment, but essentially allowed for contact update information, SNAP and TANF alignment, engagement by managed care organizations directly to individuals, which is something previously not allowed. And Ohio did a few things related to this. Number one, aligned eligibility with SNAP. So what this means, if you are determined in SNAP to be eligible for SNAP, that it will automatically determine you eligible for Medicaid. That makes things a lot more simple for the state, for counties, and for individuals. Also, no income renewals were automated. So if there was no income reported through verifiable means, that means you automatically had your eligibility redetermined. Again, managed care contacts could be made. And then obviously there was this requirement that if there was a change of address, that the state has to work and coordinate with the United States Postal Service on notice for change of address information so that they could issue notices appropriately. The one thing I want to highlight here that will be available in the slides is this link to a compendium of resources that the Ohio Medicaid Department put out. You can see an example of that to the right, door hangers, flyers, contact information, ways to communicate the resources for individuals so that people can be able to maintain their eligibility appropriately. I'd also want to highlight that Ohio Medicaid has taken some significant steps to reform its eligibility processing, specifically in the areas of ex parte renewals and increased reasonable compatibility thresholds. It's a little bit wonky, but basically in ex parte, if the state has some data available to them that suggests that a person should maintain their enrollment, they're responsible for doing that without the person having to go through the process themselves directly. So if they have some state, some information, some data to suggest that people should maintain their eligibility, they will do that, and the person doesn't have to do anything directly in terms of paperwork. The compatibility is all about, when it comes to the sources of information relative to income, essentially what's that threshold? Is it exact around, say, like with the Medicaid expansion group, 138% of the federal poverty level, or does it live within some threshold that says, yeah, this is most likely within a certain bracket? So we increased the variability that was potential for income information to qualify for the program. Next slide, please. The Consolidated Appropriations Act had a number of provisions in it. I want to just highlight a few of these things because some of this gets into the eligibility and funding components. Some of this is beyond that. But a few highlights here. Number one, it terminates the continuous enrollment piece on March 31st. The state of Ohio has already started the process of notifying individuals enrolled in the program that they may need to reach out to the state in order to be processed through starting in April. So if you watched the Joint Medicaid Oversight Committee yesterday, you heard from the state that they're going to send termination letters for folks who did not respond starting April 1st. And that means that they will lose coverage by the end of April. It also imposes penalties on states in the form of that federal medical assistance percentage for non-compliance regarding reporting requirements, which includes corrective action plans. And we'll go over the reporting requirements here in a moment. It also requires continuous enrollment for children in Medicaid and CHIP for a full year. Now, Ohio already is one of the states that does this, and actually we're pursuing or are interested in pursuing policies which maintain that eligibility much more than a single year. So this provision doesn't really have an impact on us in this state. It also makes the postpartum coverage option permanent. So for those of you who followed the budget process, last time around, one of the things that Ohio did is increase the amount of time that postpartum coverage was available from 60 days to a full year. That was provided under the auspices of a temporary sort of policy provision up to 5 years. Now that provision is permanent. So we don't have that clock coming in to suggest that states are no longer able to do this. So states will be able to keep this in place in perpetuity. It also introduced policies related to mental health and juvenile justice in particular, and then phases down the enhanced federal medical assistance percentage that's available to states over a certain amount of time. And we'll talk about that in more detail. Something for all of you to pay attention to, something that I know that advocates for Ohio's future, the food banks and others will be paying attention to, are the reporting requirements. So the Consolidated Appropriations Act had a number of pieces in there including metrics around things like the number of beneficiaries who were renewed through ex parte, coverage terminations, procedural terminations, the number of individuals enrolled in CHIP, the Children's Health Insurance Program, as well as call center volume, wait time, and abandonment rates. CMS, before the act, had also indicated a number of requirements for states regarding reporting, including things like applications, renewals, when renewals were due, months associated with each of those items, as well as the amount of fair hearings pending. So despite these reporting requirements being in place, I think what's important is, number one, it gives you a sense of how the state is performing relative to this eligibility transition. But there's also just the sort of stick of losing federal medical assistance percentage or additional federal support for not hitting those benchmarks. So something that will be really important for everyone to pay attention to are these metrics, because it can serve as a place for advocacy and accountability for states. Next slide, please. So the EF map phase down is conditional. That means that if you're going to be able to receive that, you must meet the federal requirements. You must use the change of address database on contacts, and you can't disenroll anyone based on return mail until the state has made a good faith effort to make a contact. And the state of Ohio has done a lot to try to collect addresses, to try to collect information so that it's able to do that. Some other policies of interest for folks here. EPSDT, otherwise known as like well child visits, was expanded to include additional measures associated with institutionalized justice involved youth. That takes place and goes live on the 1st of January in 25. Also, youth can be covered for services within institutions on that same date. That's a significant change because traditionally Medicaid does not provide services in institutional settings in states. Managed care organizations must publish provider directories. This happens by July. And then there's additional guidance and technical assistance for states to improve crisis response. There's the extension of Medicaid follows the person, or money follows the person, which is a way for individuals to transition out of long-term care institutional settings into home and community-based settings. And there's additional income protections for spouses as individuals seek waivers for home and community-based supports. Next slide, please. So this comes directly from the state during their testimony last week. This gives you a sense of how much money we're talking about with the phase down of that enhanced FMAP. So you can see here the different quarters associated, how each quarter it ramps down a little bit. So where we've received over 4.5 billion, that is going to be changing over time. So the overall benefit diminishes. And this is important in the context of the state budget, because depending on the state's decision and how they may work on reporting requirements, this amount can be affected. And we're talking about swings in hundreds of millions of dollars, billions of dollars. So it's really important that the state not only take advantage of this because it deals with budget solvency generally, but it also impacts the general budget because most money associated with Medicaid in our budget is not state GRF. In fact, only $1 out of $5 and less than $1 out of $5 lately comes from state general revenue sources. Most of it is federal. So if the federal aspect of this gets impacted significantly, it can cause big disruptions in the state budget. Next slide, please. In terms of enrollment, you can see here what we've seen over state fiscal years. You can see that increase over time. The significant number of beneficiaries from an eligibility standpoint are those in Group 8, the expansion group, as well as CFC, covered families and children, or MAGI group, so like kids and parents mostly. And so the Group 8 expansion, what's important here is the expansion group already had an enhanced rate, so the financial benefit associated with continuous enrollment with expansion wasn't really there. And that's why I say, and why a lot of folks talk about how the disproportionate benefit went to the age, blind, and disabled group, because oftentimes, while they represent a smaller number of people enrolled in Ohio Medicaid, they often are the ones who are the most resource intensive. So when we're talking about who's impacted by the public health emergency, for example, and how the enhanced funding benefited Ohio, the folks who are benefited the most are those with developmental disabilities, in institutional settings, so on and so forth. It is not the expansion group financially, at least, or covered families and children, parents and kids. Although for both, it's been a critical work support for them to have access to that coverage. And so that leads us to the next sort of slide about some things to consider here. So when you think about what the impacts of this may be on Ohio in terms of this transition, a couple of things I want to highlight. First of all, many Medicaid managed care plans across the country are concerned about what the enrollment impacts of this will be. So the continuous enrollment requirement, which will change, many managed care plans are predicting or expecting about 10 to 25% of their enrollees losing coverage over that time frame. Now, in some cases, this may lead people to go into the marketplace, but that's a significant amount of people. And I'll talk about that here in a moment. But overall, Health and Human Services estimates that about 15 million people will lose coverage. The Kaiser Family Foundation estimates about 8 million will lose from ineligibility. In other words, they're no longer eligible for the program because their incomes have increased or they received coverage from another source. But that 7 million will come from procedural snags, which is about 47% of the people they estimate will lose coverage. So if we use that rate of 47% and apply it to roughly the 200,000 that the Office of Budget and Management highlighted as being the people losing coverage from the state's efforts, that's about 93,000 people who could lose coverage over the course of the termination period. So it's a big number out of 3.3 million, but obviously over the course of several months, it's much more manageable than what could be the case otherwise. But this is why the data is so important to pay attention to. Is that number accurate? Is it going to be higher? Is it going to be lower? How do people receive some sort of support so that if they do need medical services, they're able to enroll effectively? Some insurers are expecting significant shifts into marketplace plans. United Health in particular has highlighted how they're expecting increased revenues because of people leaving Medicaid products and going into private insurance. So that's something to pay attention to. And then we also just finished our managed care procurement process. And with managed care procurement, the number of people enrolled in the program versus how much they cost and the relative risk profile of those individuals is very dependent on what happens with enrollment. So if we see big sudden shifts downward in the number of people enrolled, and we know that those people are most likely going to be a part of the expansion or kids or parents or otherwise less expensive individuals, that could create some significant challenges around the actuarial soundness or the relative liquidity, if you will, of the managed care plans in our state, which also may lead to network adequacy issues, et cetera. So I think the state of Ohio deserves some credit here, understanding this over the last several years to put into place some good procedural efforts to maintain eligibility where possible, to take advantage of the enhanced FMAP wind down, and to responsibly fiscally manage not only the state's budget, but also their procurement process as a necessary systemic connection, having a necessary systemic connection to some of these dynamics. Next slide, please. All right, so this is the last slide, and these are some links. Again, the slides will be available to everyone. There's a lot of resources out there, whether we're talking about the due process rights of individuals, the fair hearing rights of individuals, as well as some key information from the federal government and from Georgetown with the national health law, program, the National Center on Law and Elder Rights. Those are some of the more specific resources around the rights of individuals and how they can be protected. The Health and Human Services fact sheet on PHE termination. This can help provide some more context on the federal level about how these systems are actually supposed to be implemented and what the state's obligations are. And then the Georgetown resource gives you a little bit more context about what the reporting requirements are for states and resources to access that information. So if you are an advocate who's interested in what some of the metrics are and are unsure about what's being asked of the federal government and where that information exists from the state, that is a good resource for you. So with that, I will pause, take a moment. I'm happy to answer whatever questions any of you may have.
Loren, so beautiful. Thank you so much for being here and sharing with us today. We know we have a couple questions in the chat for you, as well as some for Joree as well. Before we move to questions, just wanted to briefly highlight some of the resources that I know Joree mentioned in her presentation. We will have some more coming up in Medicaid shortly. Here on our website here at advocates4ohio.org/2023 SNAP changes. As Joree mentioned, we do have a great deal of resources that, again, were put together with organizations like Joree's and others. JFS had input on scripts, on frequently asked questions, on flyers, on resources to post on social media, sample tweets, newsletter blurbs, lots of different information and resources for you to download and use at your discretion to help us spread the word. Once again, we know those SNAP changes will hit families first. And then coming next week, make sure to revisit our website. So it's under the resources section on our website. It'll be right under here. Under SNAP changes, we'll have a Medicaid frequently asked questions, again, additional resources, links to our partners at Get Covered Ohio for those navigator services, and just really incredible places for people to ask questions when they do start to get those notices. There's redetermination notices. We know that can be a very, very confusing process. So that will go live on our website early next week. So we hope that we can continue to provide the best resources and up-to-date information as possible for you throughout this process. So we will go ahead and move on to questions. We had a number of great ones for both Joree and Loren. And Joree, we're going to start with the online EBT pilot program. Is that still happening in Ohio? And are there any plans to expand that program?
Yeah, I think you're referring to the flexibility and expanded options to shop with your SNAP benefits online. And yeah, that's one of the silver linings that has come out of the pandemic, is that it has accelerated the modernization of spending with SNAP benefits in a more equitable way. So we see that only continuing to accelerate. I think retailers have to obviously invest in the infrastructure required to accept those payments online, and they're obviously not at this point likely to disinvest in that because they've set up those procedures. So that is definitely a benefit that should remain long-term and continue to grow. And information about the retailers that do accept SNAP benefits online is available on our website at ohiofoodbanks.org on our Get Help page.
Sure. Thank you. Next one for you, Loren. And this couples with a question I had for you as well. Do you think we will see more administrative disenrollments in Medicaid in this process than we normally would? We actually heard from Director Corcoran in the Senate Medicaid Committee earlier this week that in normal times, 50% of disenrollments are administrative, which surprised me. Wondering what your thoughts were and if you think that percentage will increase.
Yeah, that's a good question. I think there's a question of what's normal, and the real question is volume versus rate. And then how do we put this in context? First of all, there's a lot of folks who now work at JFS who've never even processed the Medicaid eligibility like previously. So the last several years with continuous enrollment, with changes in the workforce, there isn't a lot of experience. So I do think that there's going to be upfront some administrative challenges. However, I think Ohio is way ahead, to be honest with you, compared to a lot of other states when it comes to what it's done to prepare for the public health emergency. I've been looking at several states, including a state like New York, which, I think we could argue like the political conditions might seem more favorable to eligibility maintenance. But procedurally or mechanically, Ohio has done a really good job to improve its system through the types of stuff that we're talking about, has taken advantage of several waiver opportunities to make that system more streamlined. So whatever the administrative results of that will be, I think is dependent on whether or not that system works. But they have been testing it, and the test rates have been going pretty well. I think the fact that they're saying 200,000 out of an increased enrollment of 1.2 million, to me indicates a pretty solid effort to contemplate this, because if you do the comparison, then 28%, we saw a 28% increase in overall enrollment, but then we're talking about a much smaller number of people who would be rolled off. So that to me means that their automated processes are probably, they're expecting it to go well. The proof is in the pudding. So that's why the reporting really matters in this. I could see 47% for administrative reasons still being the right rate. But the question is, if that's for 200,000 people as opposed to 1 million people, does that mean that 800,000 people were more appropriately managed at ex parte or otherwise? And thus, does that mean that the system is performing better overall? So I think it remains to be seen, but I feel pretty confident about a lot of what the state has done from a policy perspective.
Excellent. Thank you so much, Loren. Joree, up next. We have a question and concern about the food bank's capacity for the increase in community referrals that will be coming in. Can you address the best referral process from community navigators and care coordinators?
Yes, thank you for the question. I think it goes without saying, but I will say it in case it needs to be said loud and clear, that there is no way in which we will be able to fill this gap. There's absolutely no way. We're talking about $126 million in federally funded food assistance benefits per month that will go away overnight. And that's at the same time that we are serving more people than we've ever served, because we serve up to 200% of the federal poverty level, which means that about half of the people we serve are not low enough, do not have low enough incomes to qualify for SNAP in the first place. And obviously those families have been under significant pressure for months. We've seen credit card debt skyrocket back to where it was pre-pandemic. Folks are just saddled with debt to try to keep up with their basic needs. And so we are already at the point of lightening the bag when people come get help, right? We're giving them less each time they come for help. We're giving them as much as we can so that we can try to have something there for every person who comes to us. I hear, unfortunately, more and more often that our food banks have to limit how many people they can serve per distribution, because there's only so much food to go around. And I want to make sure to emphasize we're very grateful that the DeWine administration and the General Assembly has taken action over the past several months to give us one-time emergency assistance to get more food in the system. That's going to help us with what we're already experiencing. And we're very fearful of what's to come. But I just want to emphasize that we never want to deter anyone from coming to get the help they need. I am personally concerned that older adults in particular will feel compelled to stay at home and not ask for the help that they need out of concern. So, that there won't be enough to go around for kids and families. So I would encourage you to continue to refer folks when they need help. We're here to help, and we want to help, and we're going to stretch resources as best we can. But we appreciate you joining us and advocating for more resources to help us drive more food into the system.
Joree, thank you so much. Loren, next question for you. Why will the ABD, or the age blind and disabled group in Medicaid and other populations go up in the next couple of years when all the others are going down?
Why will it go up in the next couple of years? I'm not sure that is. Let me sort of highlight a few things. The PHE experience was that the ABD category was relatively flat, though we saw some increases in certain areas. And what we know is that Medicaid expansion has sort of created a informal disability pathway for many into Medicaid. And what I mean by that is, as people got coverage, they finally had access to clinical supports. And through those clinical supports, there's essentially the clinical discovery process of disability, whether that's physical, developmental, or otherwise. So we've seen historically some relative increase in the disabled population before the PHE and through the PHE as a result. Now, in terms of predicting the future and why we may see the ABD category increase, I'd say it's driven by two things. Number one, demographics. Ohio is an aging state. I think there's reasons why we're putting billboards in New York, and that's because there's a lot of folks who don't see Ohio as a place for opportunity. And so the fastest growing demographic group are the folks over the age of 60. And so that's naturally going to increase that amount. And Medicaid is the primary payer for long-term care services in the United States. Most people think it's Medicaid. The reality is Medicare. The reality is Medicaid pays for most long-term care services. I think too, we still are in the middle of a pandemic, and we're not sure what the impacts of that will be on disability status. I mean, it's a reality that COVID has detrimental impacts long-term for individuals' health. And so I do think that there are going to be more people who have long-standing chronic issues, disabling issues as a result of the pandemic, which is one of the reasons why you put in public health measures in the first place. So I feel like we're going to be literally paying for this, and our public health response and the sort of shortfallings of it for years to come. So, but that being said, it's been relatively stable in small percentages over time when it comes to enrollment.
Great. Thank you so much, Loren. Joree, two quick ones for you. So get ready. First is SNAP benefits for eligibility. They go off gross monthly income, not yearly income. Is that correct? And then second, someone would like for you to expand on the possibility of individuals SNAP or shopping with SNAP benefits online and how that process happens.
Sure. Okay. On the first question, simply, I usually use annual income because sometimes it's simpler for folks to think about as they're thinking about the eligibility for SNAP households. But yeah, I think to your point, your question is if someone were to lose a job and lose income having not been eligible in the previous month, but now eligible, their eligibility would be determined on their current income situation, not their past income situation. So similarly, if someone receives a better paying job, they would need to report that increased income to the county to redetermine whether or not they continue to be eligible. And then just on the online shopping, retailers aren't required at this point to permit that, but more and more are interested in doing so. And so they have to go through an application and approval process with the state and the feds. And many of them have done so willingly and happily, so that they can more adequately provide, purchasing options to their SNAP customers.
Excellent, Joree. Thank you so much. Loren, next question for you, which you're typing an answer to. But rather than type, maybe you could share a little bit about how different managed care organizations are continuing some services to run the pandemic, such as transportation to food resources, maybe some of those options that managed care stepped up to help folks. Will they continue? Will they end soon?
Yeah, that's a good question. I think there will be instances where managed care will continue to provide services for transport to non-emergency issues, non-emergency medical transportation. I think the standard has always been, does it meet the threshold around medical necessity to be a billable act under Medicaid? Many managed care organizations were providing additional services on top of that, simply because, this gets a little wonky, but insurance companies made a tremendous amount of money during the public health emergency. And the reason they made a tremendous amount of money is because they were spending less because people weren't using healthcare services as much. And so in order to maintain their nonprofit status, a lot of these folks spent down into the medical loss ratio or their medical efficiency ratios that are required for states. So they had additional cash to try to make certain types of investments. That is less likely going to be the case, especially as providers increase their rates because of staffing shortages and inflation and so on and so forth, and as people start to utilize more services. That being said, I would say that a lot of managed care entities are doing what they can to help address the social determinants of health. It is primarily determined by medical necessity, And I would certainly encourage any organization to connect with their managed care partners and talk about ways to continually support individuals, especially as they lose benefits, because obviously there is a connection between social risks like food insecurity and insurance risks, and the new contract in Ohio Medicaid very much so contemplates that relationship.
Loren, thank you so much. Friends, we do have our time at 11:31. My goodness, sorry for going over a little bit, but want to thank you to our speakers, Joree and Loren, for your time today, for your expertise, for your advocacy, for all that you do. Truly, we're so thankful for you and for your guidance throughout this process. We will be back here in 2 weeks with a new, more budget focused kind of content of what we're seeing in the governor's introduced budget. We have an eye of a fantastic topic. We will reveal that pretty soon, so keep an eye on our newsletters as well as our social media. Again, the recording and slides for today's webinar will be sent out to all registrants later this afternoon, and they're always open and available for viewing and to look at our website at advocatesforohio.org/webinars. So very, very quickly before I leave you, we did have a question in the chat about if the materials and resources that we talked about today were available in Spanish or other languages. I would like to highlight that on our website at advocatesforohio.org/SNAP changes. We do have a number of translated flyers for the SNAP end of emergency allotments in Arabic, Russian, Nepali, Mandarin, Somali, and Spanish. And Sarah, please correct me if I'm wrong, but what's going up on our website for Medicaid for the change on our early next week will also have some translated materials, particularly for getcovered.com. So I do believe we will have some options, and we want to make sure that we hold us accountable on that, because we want to make sure that we provide those translated materials and so that they are widely available for folks. We know that we want to make sure that all populations can get this information in the best way possible. So we very much appreciate you, and thank you so much for your attendance and for being here today. We will see you in 2 weeks. Again, keep an eye out on our social media and newsletter for what will be coming at you. Thank you again for your time. Hope you have a great rest of your Friday. We'll see you again soon. Thank you.